Ever noticed feeling a bit more tired than you should, or maybe a subtle hint of yellow in your eyes in the mirror? It can be a little unsettling, right?
Yeah, definitely.
Today, we're going to dive into something that might just explain those kinds of subtle signs. Gilbert syndrome.
Exactly. And it's not some really obscure illness, actually. It's surprisingly common, a genetic variation. You could think of it as just a minor quirk in how your body handles a certain compound.
A quirk. Oh.
Yeah. So we're going to break down Gilbert syndrome using the kind of information that's, really useful for understanding your health, maybe even for exam prep, like the MSRA.
Right.
Our mission today is really just to give you the essential insights without making it overwhelming.
Okay, so Gilbert syndrome, what is it exactly? Like, in plain terms.
Okay, simply put, Gilbert syndrome is a genetic condition. It's considered benign, which basically means it doesn't cause any serious harm to your liver.
Benign, good.
Yeah. The main feature is that it can lead to mild and sort of occasional increases in something called unconjugated bilirubin in your blood.
Bilirubin, that rings a bell.
Yeah, bilirubin is just this yellow pigment. It comes from the normal natural breakdown of red blood cells. In Gilbert's, the liver just takes a little bit longer to process it. And importantly, there's no increased breakdown of red blood cells themselves. That's what we call hemolysis. And there's no underlying liver disease. Your standard liver function tests, they'll also come back normal.
So it's that bilirubin stuff that causes the slight yellowing sometimes. And you said it's in our genes.
Precisely. It's what's called an autosomal recessive condition. Usually that means you need to inherit a specific gene variation from both parents to actually have the syndrome.
Both parents, right.
The core issue lies in a less efficient process. It's called bilirubin conjugation. So imagine your liver needs to get bilirubin ready for disposal, making it water-soluble. In Gilbert's, the enzyme that does this job, UDP-glucuronosyltransferase, well, it just isn't working at its absolute peak performance.
UDP-glucurono.
Oh, wow. That's a bit of a mouthful. Is there any way to remember that, or the condition generally?
Absolutely. Let's use a little memory tip here. Think gently yellow.
Gently yellow.
Yeah, Gilbert syndrome often just shows up as a gentle, kind of yellowish tinge to the skin or eyes because of that slightly raised bilirubin. So gently yellow helps you remember the key visual sign and, crucially, the mild nature of the condition.
Gently yellow. I like that.
Yeah.
Got it. So what's the actual trigger for this gently yellow situation, biologically speaking?
Well, the underlying cause is a variation, or you could call it a mutation, in the UGT1A1 gene.
UGT1A1?
Yep. That gene basically carries the instructions for making that really important bilirubin processing enzyme, the UDP-glucuronosyltransferase we mentioned. When this gene has a certain variation, the enzyme it produces is just less effective. That leads to the slower processing of bilirubin. Okay, that makes sense. Are there any other health conditions that tend to sort of pop up alongside Gilbert's syndrome? You mentioned associated conditions earlier.
Yeah, it's quite interesting, actually. Gilbert syndrome can sometimes be seen in people who also have other conditions affecting their red blood cells.
Oh, like what?
Things like hereditary spherocytosis, congenital dyserythropoietic anemia type 2, and thalassemia. There's also been an association noted in some people with type 1 diabetes. It's not necessarily that one causes the other, but they can sometimes coexist in the same person.
Okay, so we know the cause, this UGT1A1 gene thing. Who's more likely to actually have Gilbert syndrome? What are the main risk factors?
Right. Well, the biggest risk factor is definitely having a family history of Gilbert syndrome. That genetic component is really key.
Makes sense.
We also tend to see it diagnosed more frequently in males. And lastly, certain things that can put a bit of extra strain on bilirubin processing, like some medications, or maybe other underlying conditions, they might make the effects of Gilbert syndrome more noticeable in someone who's already predisposed.
So if it runs in your family and you're male, it might be something to be a bit more aware of. Okay, let's dive a bit deeper into the nuts and bolts, the pathophysiology. How does this actually work inside the body?
Right. So as we sort of touched on, the central issue is that variation in the UGT1A1 gene. This gene gives the body the blueprint for making uridine diphosphate glucuronosyltransferase 1A1, or UGT1A1 for short. That's the enzyme that attaches glucuronic acid to bilirubin.
Okay, attaches something to it.
Yeah, this attachment process, it's called conjugation. It makes the bilirubin water-soluble so it can then be excreted from the body. In Gilbert syndrome, the activity of this enzyme is typically reduced by about 60 to 70%.
60 to 70%. Wow, that sounds like a pretty significant drop in efficiency.
It is, yeah, but it's usually still enough to prevent, a dangerous buildup of bilirubin. What's also quite interesting is that there isn't just one variation. There are many different specific variations, over 100 identified so far within that UGT1A1 gene that can lead to Gilbert's syndrome.
Over 100.
Yeah. And these variations can even be more common in certain ethnic groups compared to others.
That's a lot of genetic diversity involved.
Yeah,
But you mentioned earlier, crucially, that it's not harmful in the long run. That's definitely good to know.
exactly. It's really not linked to progressive liver damage, and because the impact is generally pretty mild, things like genetic counseling aren't usually necessary.
Okay.
And just to quickly recap the core mechanism, a little mnemonic here: reduced conjugation, raised unconjugated bilirubin. That's the absolute essence of what's happening physiologically.
Reduced conjugation, raised unconjugated. Got it. Makes sense. Now, if someone does present with that slight yellow tinge, how do doctors differentiate Gilbert's from something potentially more serious? What's the differential diagnosis look like?
That's a really, really important question. You absolutely need to carefully consider and rule out other reasons for jaundice. We can sort of broadly categorize these possibilities. First off, we need to think about other issues that directly affect the liver itself, like various forms of hepatitis or conditions that cause an increased breakdown of red blood cells. That's the hemolysis we mentioned earlier.
So we're mainly trying to distinguish this from more serious liver problems or a higher rate of red blood cell destruction.
Precisely. And within the category of unconjugated hyperbilirubinemia itself, that raised unconjugated bilirubin, we need to consider other causes of hemolysis too. Things like autoimmune hemolytic anemia, G6PD deficiency, sickle cell disease, thalassemia, hereditary spherocytosis, some of which, as we noted, can sometimes coexist with Gilbert's.
Right, the overlap.
Yeah. Even something relatively simple like the reabsorption of a large bruise that can temporarily elevate unconjugated bilirubin. And then in rarer situations, we'd consider the more severe genetic conditions affecting bilirubin processing, like Crigler-Najjar syndrome types I and II. They involve much more significant enzyme deficiencies.
So quite a few possibilities to keep in mind there.
Yeah.
What about medications? Can they also cause bilirubin levels to rise?
Yes, definitely. Certain drugs can indeed impact bilirubin levels through various mechanisms. For instance, rifampicin can affect a conjugated bilirubin. A paracetamol overdose obviously has complex effects on the liver.
Right.
Estrogens and erythromycin have also been associated with increased bilirubin sometimes, and some medications like sulfasalazine and methyl-dopa can occasionally trigger hemolysis, which then leads to an increase in unconjugated bilirubin.
Okay. And are there any other maybe less obvious causes to consider?
Yes, a couple. In newborns, we always think about breast milk jaundice. And interestingly, an overactive thyroid gland, what we call thyrotoxicosis, can sometimes lead to decreased activity of that bilirubin processing enzyme, potentially contributing to elevated bilirubin levels.
Huh. Thyroid, too. That's a really wide array of things to consider when someone presents with jaundice. So just to clarify, for like a young adult with intermittent yellowing, conditions like hepatitis, maybe various hemolytic anemias, and Gilbert's would all be on that initial list of possibilities.
Exactly right. The pattern of the jaundice when it happens, how long it lasts, along with any other accompanying symptoms, and crucially, the results of blood tests all help us to narrow down the diagnosis.
Okay, speaking of how often this occurs, you said it's common. What do the actual numbers look like for Gilbert's syndrome in the population?
Yeah, it is surprisingly common. In the UK, estimates suggest it affects somewhere between, say, 3 and 10% of the population.
3 to 10%. Wow.
Yeah. Globally, the overall prevalence is thought to be maybe around 1 to 2%. However, in people of Caucasian descent, particularly in Western countries, and especially in men who inherit 2 copies of the affected gene, the homozygous state, the prevalence is estimated to be higher, somewhere between 2 and 10%.
That really means a noticeable number of people could potentially have this.
It absolutely does. And what's important to remember here is that many cases probably go undiagnosed.
Why is that?
Well, people might experience really mild symptoms and just never seek medical advice. Or maybe the symptoms get attributed to something else entirely. So the actual prevalence could potentially be even higher than these estimates suggest. It really underscores how common this seemingly unusual condition actually is.
Right. So if it's this common, what are the typical signs and symptoms that someone with Gilbert's might actually notice?
Well, the most common sign, as we've discussed, is that mild yellowing of the skin and the whites of the eyes, the jaundice.
The gently yellow.
Exactly, the gently yellow. Some individuals might also report feeling tired or fatigued, although it's not always crystal clear if this is directly due to the slightly elevated bilirubin or maybe other factors going on. Abdominal discomfort is less frequent, but it can occur in some cases.
And when does this usually become apparent? Is it from birth or later?
It's often first recognized around puberty or in young adulthood. The jaundice tends to be intermittent, which means it comes and goes.
Right. Not constant.
Exactly. And these episodes can be triggered by various things, like being unwell with a common illness, like a cold or flu, periods of stress, menstruation in women, fasting, or prolonged calorie restriction.
Ah, fasting.
Yeah, fasting is a classic one. Also dehydration, intense physical activity, lack of sleep, drinking alcohol, having surgery, and even certain medications can trigger an episode.
So even just feeling generally under the weather or skipping a meal might make that yellowing more noticeable?
Precisely. And it's really key to understand that during these times when the jaundice appears, any other symptoms a person might be experiencing, like feeling tired if they have the flu, are usually related to the trigger itself, not directly to the Gilbert syndrome.
That's an important distinction.
It is. It can also occasionally be noticed in newborns, especially if there are other factors present like hemolysis or maybe breast milk jaundice. But interestingly, a significant number of people with Gilbert syndrome are completely asymptomatic. They never even realize they have it.
Wow. So the key things to look for are that unconjugated hyperbilirubinemia. They have the bilirubin that's not showing up in urine and jaundice that seems to be brought on by things like, skipping meals or being sick. That makes me wonder, is there a helpful way to remember those triggers specifically?
There is, actually. A good mnemonic for the triggers is jaundice flares with fast stress.
Fast stress. Okay, break that down.
Sure. F is for fasting, A is for alcohol, S is for sickness, T is for tiredness, like lack of sleep. And stress covers, well, general stress.
Right.
It's a useful way to recall some of the most common factors that can make that mild jaundice more apparent.
Fast stress. I like that. Easy to remember. Now, if someone does have these symptoms, what kind of tests would a doctor typically order to diagnose Gilbert syndrome?
Right. The first step usually involves blood tests. We need to measure the levels of the different types of bilirubin and also run standard liver function tests.
Yeah, okay.
In Gilbert syndrome, the key finding is an elevated level of unconjugated bilirubin. The conjugated bilirubin level will typically be less than 20% of the total bilirubin count. And the total serum bilirubin level is usually above 17 mmol, but it rarely goes above 85 mmol.
So a specific range. And what about other things they'd look for in the blood work?
Yeah, importantly, to rule out hemolysis, that red blood cell breakdown, we would check the hemoglobin level, the reticulocyte count, which indicates new red blood cell production, and we'd examine a blood film under a microscope. These should all be normal in Gilbert's.
Okay.
The standard liver function tests, things like liver enzymes, ALT and AST, as well as albumin levels and tests for blood clotting, those will also typically be within the normal range.
All normal.
Yep. And we would also usually check the urine to make sure there's no bilirubin present. The level of urogalinogen in the urine might actually be slightly lower than normal or subnormal.
So it's really about seeing that specific, isolated increase in unconjugated bilirubin, while pretty much everything else related to the liver and red blood cells looks completely normal.
Exactly. Those blood test results, especially when you see them in someone with a history of that intermittent mild jaundice, that seems to be linked to those triggers we talked about.
The fast stress triggers.
Right, the fast stress triggers. And with no other signs of liver disease, that pattern is often enough to confidently make the diagnosis. Getting the diagnosis right is pretty important because a mild increase in bilirubin can sometimes be mistaken for a sign of more serious liver problems, which could potentially lead to a whole load of unnecessary further tests.
Yeah, you wouldn't want that. So when would a specialist, like a gastroenterologist, need to get involved in a case like this?
Well, if there's any real uncertainty about the diagnosis, maybe if the bilirubin levels are significantly higher than what we typically see in Gilbert's, or if there are other concerning symptoms, or perhaps some abnormal findings on the other tests, then a consultation with a gastroenterologist or a liver specialist, a hepatologist, would definitely be appropriate. And in really rare cases where the diagnosis is still unclear after all that, genetic testing to look specifically for those variations in the UGT1A1 gene can be considered to confirm it.
Okay, so let's say we've arrived at a diagnosis of Gilbert syndrome. What's the plan from there? What do you actually tell the person?
The most crucial thing, really, is to communicate clearly that no specific treatment is generally needed.
No treatment.
No treatment. Gilbert syndrome is a benign condition. It doesn't require active medical intervention. The focus really shifts more towards understanding and potentially managing the triggers that might make the mild jaundice more noticeable.
Right, the fast stress things again.
Exactly. So this involves advising them about avoiding prolonged periods of fasting, maybe being aware that certain medications could potentially exacerbate the condition, though that's less common.
So it's much more about lifestyle awareness than actual medical treatment.
Precisely. Recommending just a generally healthy lifestyle with regular meals, staying well hydrated that can often help minimize those fluctuations in bilirubin levels. And for a quick reminder on this management aspect, manage triggers, maintain health.
Manage triggers, maintain health. Nice and simple, actionable. What about the long-term outlook then? What's the prognosis for someone living with Gilbert's?
The long-term outlook is excellent, genuinely. Gilbert syndrome is a benign condition, and it absolutely does not affect life expectancy.
That's great news.
Yeah, it doesn't progress to chronic liver disease or cause any significant long-term health issues.
That's definitely very reassuring to hear. Are there any particular medications that people with Gilbert should be maybe careful about using?
Yes, there are a few medications that either should probably be avoided if possible, or at least used with some caution and awareness.
Such as?
These include certain antiviral medications like atazanavir and indinavir. Also, the fibrate medication gemfibrozil, especially when it's used together with statins. Statins themselves might need to be monitored a bit more closely in some individuals with Gilbert's, though it's usually okay.
Okay.
Other medications to be aware of include irinotecan, which is a chemotherapy drug, and nilotinib and imatinib, which are used for certain types of cancer.
So it sounds like it's really important for individuals diagnosed with Gilbert's to make sure their doctors and pharmacists are aware of their condition.
Absolutely. That awareness just helps in making informed decisions about medication use. And actually, here's a potentially surprising piece of information.
Oh,
Well, some research actually suggests that those slightly elevated bilirubin levels seen in Gilbert syndrome might have antioxidant properties.
antioxidant.
Yeah. Which could potentially offer some protection against certain age-related diseases, possibly including even some types of cancer. This is still an area of ongoing research, mind you, but it's quite an interesting possibility.
Wow, that is an unexpected potential upside.
Hmm.
So just to be clear, in terms of actual complications directly caused by Gilbert syndrome itself, it sounds like there aren't really any major ones to worry about.
That's absolutely correct. Generally speaking, Gilbert syndrome does not lead to any significant complications or severe liver disease. It's really more of a biochemical finding, a variation,
Okay.
rather than a serious medical problem.
Fantastic. Okay, so just to summarize everything we've covered,
Yeah.
what are the absolute key things we should take away about Gilbert syndrome?
Right. The main points to remember are that it's common, it's inherited, and it's essentially harmless. It's a condition where the liver just has a slightly reduced ability to process bilirubin, and that leads to occasional mild jaundice. No specific treatment is needed, but being mindful of those triggers like fasting, illness, stress, certain medications can be helpful. And maybe remember those mnemonics we scattered through.
Yeah, let's recap them.
Okay. Gently yellow for the key sign. UGT underperforming, maybe that helps remember the gene. Reduced conjugation, raised unconjugated for the actual mechanism. Jaundice flares with fast stress for the triggers. And finally, manage triggers, maintain health for the overall approach.
Perfect.
Understanding those core ideas is really useful, I think, for remembering the essentials.
Definitely. So if you listening, or maybe someone you know experiences these occasional episodes of mild jaundice, Gilbert syndrome is certainly something to consider talking to a doctor about. And of course, if you're looking for more helpful resources, especially for your MSRA preparation,
Yeah.
be sure to check out pastthemsra.com and freemsra.com.
Absolutely. Really valuable resources for your studies. And just remember, understanding these common conditions like Gilbert's is a really key part of being well-informed about your own health or preparing for exams.
Couldn't agree more. Thanks so much for this deep dive today.
Yeah.
Really cleared things up.
A pleasure.
Until our next exploration.